Your support helps us bring you programs you love. Go to wyomingpbs.org, click on Support, and become a sustaining member or an annual member. It's easy and secure. Thank you.
As the cost of and access to healthcare remains a big issue in Wyoming, Wyoming Chronicle visited with two physicians who are advocating for and using telehealth practices to improve patient care right here in Wyoming. What is the future and what are the challenges of telemedicine? Technology and health, next on Wyoming Chronicle.
Funding for this program was provided in part by the Wyoming Public Television Endowment and viewers like you.
As we begin our discussion on what telehealth and telemedicine means in Wyoming, we thought it would be great to have two physicians who are actually practicing and utilizing telehealth and telemedicine. Dr. Dan Surdam, he's a physician here in Cheyenne, and Dr. Lisa Finkelstein is a urologist from Jackson. To you both, welcome to Wyoming Chronicle.
Thank you, Craig.
Thank you, Craig.
I think the best question to begin is, what is telehealth and telemedicine? To me, that's such a broad question. Dr. Finkelstein, let me visit with you about that first.
Telemedicine is the term that I was most comfortable with because it's basically a way of practicing medicine using technology. Telehealth is a broader term where it's not only telemedicine, but it includes education, consultations, meetings, other ancillary services. But telemedicine is more the practice of medicine.
Can you add to that, Dr. Surdam?
Sure, no, that sums it up perfectly. And I think telemedicine as literally means healing over distances. And so when you say telemedicine or telehealth, it really is interchangeable today, but initially it meant telemedicine was, as Lisa said, it focuses more on the clinical aspect of medicine. It's you seeing a healthcare provider. Telehealth is the all-encompassing term that basically talks about other things than the clinical aspect of medicine.
Each of you has found it necessary maybe to provide healthcare and doing it this way in Wyoming. Dr. Surdam, how did you become involved in telehealth care?
Well, we started kind of rolling out telemedicine in March of 2017. So we've been doing it for quite some time now. Telemedicine actually has been around for a long time, but the technology is just finally catching up to a place where it's becoming facile for both the healthcare providers and the patients to use. And so one of our missions that we have with our company is to leverage technology to innovate, to increase accessibility, affordability, and convenience for patients. And we thought that telemedicine would be really one way to do that.
And we're going to explore later on exactly how you're doing that, sure. Dr. Surdam. Dr. Finkelstein, for you were seeing patients all over Western Wyoming, and telemedicine has allowed you to become maybe more efficient?
I think my interest started back in 2011 when we were starting to really move forward with electronic health records. And so one of the programs that was offered in Wyoming as an incentive was, and this was through Medicaid, through Dr. Bush, was to offer physicians a free camera that you could put on your computer and use this for telehealth. So I was driving to Pinedale. I drove to Pinedale for about 12 years. And I spoke to one of the physicians there. I said, let's try this. They're offering this service. Let's see if it can work. We tried for about a year, and the technology was not where it is today. We would get everything up and running, and then somebody would run the fax machine, and then the call would drop. And so we really tried for about a year. It was so frustrating. We stopped. And then it really went out of my mind because I just got busy with other things. And I drove to Pinedale and I flew to Rock Springs, and we just did it physically. But as the technology got easier, it started to creep back into my head. And I said, I think we're ready. We're ready to do it again. And we are. We're more than ready.
What's the patient experience like, someone who visits with either of you via telemedicine rather than me sitting here in your office, Dr. Surdam?
So I think it depends. It depends on how comfortable the healthcare provider and the patient is using technology, and we can get to that in a little bit. But that may be one of the barriers. But in my personal experience, it's been equally as good or better than an in-person visit.
Dr. Finkelstein, it's been such a buzzword here. We're filming this in Cheyenne, and it's almost like telemedicine is the great panacea for solving the healthcare crisis, or at least helping with the healthcare crisis in Wyoming. Is it truly that, or what are our expectations for what telemedicine can provide not only patients but physicians here in the state?
Well, if you ask Dan and I, we would say that it is one of the biggest answers to medicine in this rural state. However, if you talk to the average physician and the average patient, because they really don't understand how it works and really how easy it is, they question, there's a lot of questions. Is it really the next best thing since electricity, let's say? I truly believe that it is. I think that it is so simple to use now that if you educate the physicians and you educate the patients, that it will be the next big, huge thing in medicine.
If I'm a physician watching this right now, and I'm thinking, well, I don't know, I'm not that tech savvy. I'm very great with patient care, but I don't know anything about maybe, computers or telecommunications. How can they become more tech savvy, if you will?
So, and I think that's one of the barriers why there hasn't been more utilization of this technology is that on the healthcare provider side, there is that hesitancy to really adapt this technology. One is that it has to be super easy. So it has to be intuitive. If I'm a busy physician practicing medicine, seeing 50 patients a day, I'm not really going to want to be bothered with trying to figure out telemedicine. But once you realize how truly simple it is, all you need is an internet connection and a software platform that's HIPAA compliant. It's basically like FaceTiming a patient. And so I think once you get over the inertia of, I don't know, and really try it, as Lisa said, the technology is super easy. And so, we want to educate people that really shouldn't be a barrier.
Physicians, and what about patients? Patients too. I know what my parents were like relative to they never sent an email as long as they lived. They never sent a text message, for crying out loud. And yet, maybe an expectation now is that some older folks might be able to benefit from using telemedicine. Dr. Finkelstein, what would you tell them?
So one of the ways that we can overcome that is the insurance models right now will pay if the patient actually goes to what's called an originating site or a clinic. So let's say I was practicing urology in Jackson, but we had a patient here in Cheyenne. The patient could come here where they're set up to do telemedicine. They could sit in the room. There would be a nurse that would room them. They would get the technology up on the screen. All the patient would have to do is sit down. In Jackson, a physician like me just has their laptop. We send the HIPAA compliant video conferencing and we're connected. It's that simple.
So they still make travel to a physician's office, yet still
in
be
their
able
community.
to utilize someone who's at distance, in your case in Jackson. What is the insurance industry saying about this in Wyoming?
So right now, the most robust insurance company that is the most forward-thinking is Medicaid. And that is because of Dr. Jim Bush, who actually is one of the champions of telehealth in Wyoming and has made a lot of this possible. Medicaid will pay full parity, and that means that they will reimburse the physician the same amount as they would for a face-to-face visit, as if a patient if the patient was at home using their smartphone, they could do a visit on their own, on their smartphone, at home. The physician can be in their office and then can bill that insurance company and get paid in full. Blue Cross Blue Shield requires that the patient go to an originating site. They will then pay the originating site a small fee for utilizing the room, and then the physician who's providing the service has to then bill a code with a modifier, and then they will get paid. So it's a little complicated.
On the physician side.
On the physician side.
There are some people watching this
that don't understand the coding.
Patients are going, oh my goodness, what did she just say? It doesn't matter to the patient, is what I think I'm suggesting. Correct.
And really for the physicians, we have professional billers and coders that can take care of it, and it's not even a huge big deal for the physicians.
What does the literature tell us really about how successful it is for me to come and visit with you in your office versus how successful it is for me to visit with you via telemedicine? What are we learning about success or challenges?
So I would say that it depends. And the answer to how successful the actual virtual visit is or telemedicine visit is, I think the literature tells us that the connectivity, the patient being able to connect to the healthcare provider is very good. Utilization of this type of technology still is lagging. I think we see about 1 to 10% of utilization. And so that's the biggest challenge, is getting patients comfortable, getting healthcare providers comfortable with this kind of technology. However, actually treating the patient and taking care of different ailments, it's very successful.
I'm trying to remember when we took our kids to the doctor. And I think I remember, let's take your temperature, let's weigh you, let's look in your ears, let's look in your throat, and these hands-on things. How do we do that with telemedicine? Or do we do it at all? And it makes me, again, wonder, can they be equivalent in the outcome?
So the general thinking is that telemedicine, 90% of telemedicine is what we're doing, or 80 to 90%.
What do you mean by that? Just visiting.
We're doing a video, right? We're chatting, we're talking, we're getting a history. The other part that you're talking about, where you need to examine the ear, examine the throat, those kind of things, there are devices that we call peripherals that basically it's a USB port, you hook it in to the computer, and if you're at a visiting clinic, at least for right now, the nurse can, or a PA or nurse practitioner, can put the teleotoscope in the ear. The provider on the other end can see
could be a specialist, you're saying, on the other end can see all of those
or
things.
primary care doctor. Mm-hmm. We have stethoscopes where you can listen to the heart and they can hear that. We have peripherals for everything, and ultimately, as you know, you're a technical guy, is that a lot of these peripherals are also being done at the home. And so lay people are going to be able to, take their oxygen level, take their blood pressure, look in their mouth with these devices, these peripheral devices. So the technology is there. It's now we just have to get people to engage. We have to get physicians to buy in and start using it.
I just wanted to add to that. So there's certain things that definitely can be treated without the peripherals. If you have a skin rash, if you have sinusitis, if you strained your back, travel medicine, if you're going to Kenya and want to know what kind of vaccinations you should get, a urinary tract infection. I mean, things that you typically would think, well, maybe I need to go to a brick and mortar clinic to be seen. You would be really surprised by the things that we can treat just without the electronic stethoscopes or the otoscopes to look in the mouth. But there are things that you can't treat unless you have those peripherals. So you would either have to go to a clinic that has those peripherals or actually come to a brick and mortar location.
So if I'm a patient and I'm wondering, well, does my physician engage in this, or should I suggest to him that he or she does utilize telemedicine more effectively? I live 20 miles out of town and I don't like to drive through the mud and snow to come see the physician. What should patients be talking to their physicians about if they're interested in telemedicine?
So I have actually gone that route because it is a little more difficult to explain this to the physician, it's very easy to explain it to a patient. So I have begun to educate patients about how to go about asking your provider, do you do this telehealth thing? Because I do live so far away. So I think if we do start educating patients about asking their providers if they utilize this technology in this service, I think we will push it a little bit more because patients get it immediately. And we're all patients too, but if you're a mother and you have children and you have to take time off of work, it doesn't make economic sense for the state of Wyoming to have people schlepping around Wyoming, getting in their cars and driving everywhere and taking a day off of work when they can utilize this technology and get care within 15, 20 minutes.
Dr. Surdam, there are people also out there that are wondering, I can get this care in Wyoming. Am I going to see my doctor always at the same time? Is it going to be somebody else different on the other end? Are there privacy concerns? I don't want any of my data going up in the cloud or on this internet thing. What do you tell them?
My response to that would be most electronic medical records these days are on the cloud anyways. The technology that we utilize is all HIPAA compliant. So we take the same safeguards with a telemedicine or virtual visit that we would if you had an in-person visit. And so all those safeguards are in place. We make sure that the software is HIPAA compliant. And so really there is no difference between an in-person visit and a telemedicine visit in that regard.
It strikes me that family members can also utilize maybe technology a little better. For instance, if the family member who is very interested in my healthcare lives in New Jersey, does telehealth allow them also a better avenue to participate? Are we at that level where they can actually be less guilt-ridden, so to speak, if they don't live right in the same community with their loved one?
With most third-party software, telemedicine software systems, we actually do have the ability to do a third-way call. So
A conference call.
A conference call, exactly. So literally, if we wanted to involve a third party, a family member, or a urologist up in Jackson, it takes one click of the button and they would be conference called in. It'd be similar to a Google chat room, but it would all be HIPAA compliant. So it most certainly would make that feasible.
There are times when telemedicine just doesn't work, where you have to refer to a specialist, et cetera. What happens when you experience that, Dan?
So the way we message that to our patients if we're doing a telemedicine visit, if it's something that can't be taken care of by that visit, we refer them back to their primary care or to the urgent care, and we waive the fee for that visit. And so it happens not frequently, but sometimes, and that's just part of delivering care. That happens in the clinic as well, where they come in and we can't take care of it. We have to refer them out to a specialist.
Have you found that this doesn't treat all socio-demographic folks the same? There are some folks that just don't have this technology in their home, but would like to. Are there programs? Are there assistance? Are they left out? Have you experienced that?
I know that we, through the Medical Society, have spoken to nurses. I myself have spoken to nurses that do chronic care for people that don't have the means. I have to say that the government is supported. The federal government is also supportive of these programs, and there's grants to try to get technology and to utilize this technology in these underserved areas. But that is one of the one of the great opportunities of telehealth is that you can use it in the schools, in many group homes, all different kinds of services where they didn't have access to medical care. Telehealth can help provide that.
And in the state, as Lisa alluded to earlier, with Medicaid, they cover telemedicine. And so all you really need is a phone. People may not have a computer or a tablet at home, but if you have a phone that has a camera and a microphone, typically you can connect to this type of service.
Dr. Finkelstein, there is also the Wyoming Telehealth Network that is a resource for providers.
So the Wyoming Telehealth Network used to be the consortium, again started by Dr. Jim Bush. Corey Jenkins is the director of that now. He's at UW in Laramie, and what it is a resource for providers to go to learn all about telehealth in Wyoming, and also to enroll so that you can get this HIPAA compliant Zoom license to utilize in your practice, and it's a wonderful resource.
Dr. Surdam, you have a unique practice in my eyes, something that I've read about in other states, but now it's available here in Wyoming. You actually sell memberships, and we're filming this here in your offices at Stitches Acute Care. Tell me about your model, if you will.
Sure. Well, as you know, and this is part of a much broader and bigger conversation, that we think the healthcare system is broken. And so we try to innovate and come up with different solutions on a small scale in terms of how can we make a large impact within our community that we serve. And one of the things that we saw and that we really liked was a movement called direct primary care, where you would have primary care physicians, instead of billing insurance, they just charge their patients who become members a monthly reoccurring fee, and then that allows unlimited access to that provider. So it's kind of getting rid of all the middlemen and getting that physician-patient relationship back again, and allows the healthcare provider to really just spend time, get to know their patients. They don't have to worry about billing insurance. They don't have to worry about a quota of seeing 5 patients an hour. They have a limited amount of members, and it's enough for them to survive on. And
So the way it works in your case, someone can come here to the clinic, or they can utilize telehealth.
correct.
And when they get on their computer, what's going to happen if they have a membership in Stitches?
So if they have a membership in Stitches, when they get on the computer, they'll register at our website, and they'll be greeted by the front desk staff.
Just like they would if they stepped in your office.
Just like they would if they stepped in our office. And then they'll see the provider, and that's it. There won't be any co-insurance, deductible, a copay. It's all included.
So I imagine some people that are watching this right now might have some questions. Like, what if I also have insurance? Is this still a good deal for me? Or is this going to count towards my deductible? Or is it for folks that may not have insurance but still need access to primary care?
So all of the above.
Okay.
So what many people don't realize is, especially now, that even though you have health insurance, you're theoretically self-insured, because most people have a high deductible these days. And so what that means is you're going to pay out of pocket until you reach $1,000, $2,000, $6,000 before your health insurance kicks in. So I would say that having a membership in addition to your health insurance is a really good idea. In fact, we encourage all our members to have some kind of catastrophic coverage if they can. Some people simply can't afford it. The working poor can't afford health insurance. And so this membership program is also designed for them.
A cost of membership, and certainly the information is available on your website. We're showing that on our screen right now. But the decisions that people might make is that, geez, the cost of 1 month of insurance for my family is less than the cost of 1 year of membership. But I don't have that catastrophic or specialty coverage. What do you tell people to consider when they're thinking about a membership?
Well, the benefits in my mind are it's really designed to focus on wellness. So you don't have that copay or deductible in the back of your mind preventing you to come in. If you have a question, you can call us anytime. If you want to hop on the computer and have a virtual visit, we're here for you. If you just want to come in and talk to a provider, we're here for you as well.
I think it'd be very interesting for our viewers to see what a telehealth visit might look like.
Sure.
And we're going to demonstrate that.
Okay.
So we encourage our viewers to stay with us, and we'll be right back.
Hi.
Hi, I'm Craig. I'm calling from Cheyenne, and I think I need some help today. My eye's really sore. I don't know if I have pink eye. Is there any way that you can help?
Absolutely. And have you been to our Stitches clinic in Laramie or in Cheyenne?
I actually have. Craig Blumenshine is my name.
Okay. All right. So I'm going to put you on a quick pause, and then Sean Rocky, which is a provider in today, he's going to be taking the call.
Okay, I'm in Cheyenne. Where are you guys located?
We are in Laramie.
Okay.
So we pick up the calls in Laramie.
Nice.
Okay?
Thank you very much.
Okay. You're welcome. 1 second.
Hi there.
How are you?
I'm doing okay, I guess. How are you?
I'm Rocky. I'm one of the PAs that works here at Stitches. So tell me a little bit more about the eye. What's going on with that thing?
So it feels funny. It's really, really red. I've got like this clear tear-like thing that's draining out of it a little bit. I'm wondering if it might be. What's that?
When did all that start?
You know, it started. We're shooting this on a Monday. It was over the weekend is when kind of it came, and it's just not getting any better. I've tried a Visine or what, and that's just done nothing for this.
I'm gonna have you do a few things for me. Have you lean up to the camera as close as you can, and just pull down your eyelid there, and then just look around for me slowly. Good. Okay. Other way. Good. Up. Okay. Good. All right, you can go ahead and sit back away. Okay, perfect. And then no pain when you're looking around at all, correct?
I wouldn't say it's pain, although I kind of recognize something's going on there. Like
Okay.
eyes really super tired or.
Gotcha. Understandable. And then right here in front of the jaw, you're not having any tenderness or swelling right here that you can tell?
Not that I can tell, no.
Okay. Okay, gotcha. What we're going to presume right now is potentially, this is a bacterial conjunctivitis. If anything changes, definitely give us a call, but we're going to put you on a topical eye drop. It's going to be 1 to 2 drops, every 4 hours while you're awake. And we're going to use that for 24 hours after the eye is completely clear. Usually about, 4 to 5 days, but I think we'll kind of move on from there. If anything changes, I want you to give us a call at the clinic and, we'll reevaluate, or I'll have you go into our Cheyenne clinic or follow up with your optometrist. How does that sound?
Sounds really good. So I'll just pick that up at my pharmacy, just like I would have seen you in person, even though you're not in my town?
Yeah, that's exactly right. So what's going to happen is I'm going to, just double check your pharmacy, and then I'll send it over. They should have it filled, hopefully within the hour. But if they have any questions, they'll give me a call.
Well, thanks for your help today. I appreciate it.
Hey, no problem, Craig. Let us know if anything gets worse, okay?
I sure will. Have a good afternoon.
Yeah, you too. Thanks.
So there you have it. That's exactly what a telemedicine call can look like right here in Wyoming. And I could have been at my house, at my place of work. I could have done this from my phone or my tablet. I'm using a laptop here today, but it really couldn't have been easier.